Hi everyone, I'm Christina Klimash and we are at an interview building digital products where we speak about the technology that can boost your business here and now. And our today's guest is Maria Rankka, who is a Swedish entrepreneur, Healthtech investor, and board professional. She is also a co-founder of diagnostics startup ABC Labs and executive chairman of the stem cell production company Thelco Labs. In addition, she is an angel investor in Healthtech companies and serves both at for-profit and non-profit boards of directors. Hi, Maria.
Hi.
So let's begin our conversation. I saw on your LinkedIn that you hold a bachelor degree in political science and even worked alongside Sweden's former Prime Minister Carl Bildt. So my question is, why and how have you switched from the political industry to healthcare?
Yeah, that's a good question. So I started out early on in my career. I worked in politics, and then I spent quite a lot of years in the intersection or at the intersection of business and policy making. So I was heading for example, the Stockholm Chamber of Commerce, which is a large business organization in Sweden for 8 years. But then some 5 years ago, I did a complete turnaround of my professional life. And the short answer is that sort of love and life brought me into Healthtech and healthcare. But a slightly longer answer is that I was, during my tenure at the Stockholm Chamber of Commerce, I got more and more interested professionally in the innovation that was happening in and around Stockholm when it came to health tech and life sciences. And then on a more personal note, I became increasingly interested in longevity and all the new technologies and also all the new and old knowledge that can actually help us live healthier and longer lives. So all this combined brought me to where I am today. And I must say it's a fantastic industry to be in because it's full of hope.
It's really interesting to hear it, and I totally agree with you. And speaking about the health tech industry, as we all know, is really fast growing, and there are thousands of developed and launched solutions. And from your perspective, which specific sectors do you see gaining significant demand over the next 5 years, let's say?
No, but there is massive need for more innovation and transformation in healthcare generally. And I think one urgent need is to actually move from just trying to cure acute conditions and to work more preventatively. So I think that is the big shift that has to take place. And of course, technology could be of help here. I'm interested in, if I look at my investment portfolio in health tech companies, I'm looking a lot at companies that can use various technologies to actually help either patients or the healthcare systems or providers to keep patients healthier or optimize their care provision so they can live healthier and hopefully longer, but at least better lives with their chronic conditions. Because if you look at healthcare spendings in the Western world today, some 80% of all healthcare spendings goes to patients with chronic diseases. So if we could keep that number down or actually keep people with chronic diseases healthier, that will save a lot of money in the healthcare system, but ultimately it will actually, the patients will benefit from this because they will feel healthier. So for example, if you look at hypertension, high blood pressure, that is a deadly disease or deadly condition. A lot of people are not treating it properly, and with smart technology and smart digital care provision, you could actually keep these patients healthier for a longer period of time compared to how we have traditionally treated them. So that is just one indication, but like this goes across the lines. We can today, help people with diabetes, with hypertension, with heart failure, with like many or almost all chronic conditions, thanks to smart, the combination of traditional care, traditional drugs, and new technology.
Yeah, I think that new technology plays a significant role in the whole healthcare industry, and it's important to see how it is changing and how it brings the value to the clients. Also, as I mentioned previously, you are a health tech investor and angel investor. And as you are an angel investor, you are a big part of startup success stories. And we got many listeners who are startup founders. So can you share with us some insights on what catches your eye when you're considering an early investment in a health tech venture?
So I'm both a founder or co-founder of two companies in the space, and also an early stage angel investor, as you mentioned. And what I look at is a combination of a few things. Team is super important. So that you actually believe that the team will be able to execute on their idea. It's relatively easy to write a nice deck or a nice PowerPoint, but to actually execute and deliver and be able to sort of adapt to an ever-changing reality, I think that is absolutely key to me. Another thing, and that has become increasingly important the last few years, is that you actually have a solid business model that you will be able to earn, to get some revenue on whatever you are doing. So I think team, business model, and then lastly for me, it's very important with impact. So there are a lot of interesting companies in healthcare that will make things better on the margin or that will solve something, but that is not enough for me. I really want to see significant health outcomes of the companies I invest in. So I want them to do things much smarter and with less resources than we have previously done. So I tend to invest in innovation and really hopefully really impactful technologies.
Honestly, your values match our company's values also, because quality and impact and the team that we are building is really important and crucial for us. And sometimes we need to deliver this information and this importance to our client, because someone thinks that idea is the most important. But as for me, the business model is more important, because as we all know, idea worth nothing, and you need to prove it and validate it, and a lot of other things to do with it.
Yeah, and again, it's the combination of business model and execution. So there are a lot of good ideas, but much fewer good companies to invest in, because you have to execute on your ideas, and you have to show that you are able to actually deliver results. That is what it's all about. So I think it's also really helpful to have been part of one or a few startups yourself when you invest, because you know more about the potential problems that can happen.
Totally agree with you regarding this statement. And also speaking about our clients, we often discuss with them their desire to incorporate AI tools for things like predictive analytics, personalized medicine, or anything really. And I heard that you invested in Valor Labs, a startup using AI to revolutionize cancer care. With $4 million in seed funding, it sounds like they are making waves. And my question is, so what's your stance of the future of AI in healthcare industry?
It is, of course, a very, very large and difficult question. But if you look at here and now, AI or similar tools are already playing a very, very important role. If you look at diagnostics, for example, we know that AI is very, very often better than general practitioners to actually diagnose patients. So in diagnostics, it is already playing a very important role. And I think we will see more and more of that. You mentioned the company out of Stanford that I have invested in called Valor Labs. And what they are doing is basically that they are optimizing the treatments for certain types of cancer patients. So a lot of cancer patients are not responding to standard of care. So the standard treatments that you get when you are diagnosed with a certain type of cancer. So maybe 30% of all patients, and we know this beforehand, they will not respond to standard of care. And what they are doing is that they are predicting exactly what treatment a specific cancer patient will respond to. So instead of giving everybody standard of care, the care provider can take the right treatment, or a treatment that the patient is likely to respond to right away. And by doing that, it will save a lot of time for the patients, and it will also actually help prevent the patient from going through very painful treatments that will not work. It will also save money. So it's like a win-win-win, both from the patient's perspective, but also from the healthcare system's perspective. So I think we're only at the very, very beginning of this journey, and AI and health is definitely something that I think will bring a lot of good to the world.
Yeah, I agree with you. We just need to use it properly and try to understand how we can benefit from it. Also, your startup, ABC Labs, for our listeners who don't know, conducted over 25% of all testing for COVID-19 in Sweden, is now aiming to digitize testing. So my question is, can you tell us a little bit more information about this idea and about your future plans?
Yes, ABC Labs was founded at the very beginning of the pandemic. So we founded the company in March 2020. And back then it was more or less an impact project. We realized that there was a lack of testing capabilities in Sweden and also in a lot of other companies. We also realized that screening programs or large scale testing for COVID had to be part of the pandemic response. So we decided to build capacity early on. So we founded the company March 2020, and then we raised some money and started to build an industrial scale laboratory in Stockholm, Sweden. And we grew it from basically zero, nothing, to become the largest testing facility in Sweden. And as you said, we conducted between 20 and 25% of all PCR tests in Sweden during the pandemic. However, that is positive news, the pandemic is more or less over. So now we're pivoting ABC Labs to something completely different. So we have built a niche lab for toxicology tests, which is a market that is underserved in our region. And we're also developing a combination of software and diagnostic tools for preventative testing, because we believe that patients and healthcare providers will be more and more interested in actually knowing more about their health status over time, how it develops, and so on and so forth. And today, if you combine the cutting edge technologies, you can get a lot of information, and you can also early on adopt lifestyle, but also if you are in need of treatments, you can get those treatments early on. So that is what we are doing today, and it's super exciting.
That's great, and I wish you luck with all your new journey, and I'm excited to see your result and what your company will create in the future. Let's get more technical. At LinkUp Studio, we are building right now an AI tool designed to help financial institutions to improve the accuracy of their data, automate tasks, and process a large volume of data more efficiently. And I'm curious about the data management process over at ABC Labs. How does your company maintain, store, and gather all the data?
That is a very technical question, but it's a good one. And I will tell you a story and then answer the question briefly, because I will not be able to go into detail, as you probably understand. But when we founded, we were a group of 5 people who are the founders of ABC Labs, and we came from different path of life. We were aiming at building this industrial scale laboratory for COVID testing, as I said. But what we decided very early on was, because we believed that everything in diagnostics or health or what have you has a tech component. So we decided to build a strong tech team from day one. So our first employee was not a lab technician. It was not a healthcare professional or something like that. It was our CTO. And he had a background as a tech architect or a system architect at Klarna, one of the Swedish unicorns. So he was actually number one in our company after the founders. And then, of course, we hired lab engineers and so on and so forth, or lab technicians. But that has been the core of what we have been doing since day one. And that was also the fact that we invested heavily in our tech team. We thought a lot about sort of handling of patient data, integration into the healthcare regions that we worked with during the pandemic. We thought a lot about that early on, because we knew intuitively that will be our competitive edge. And that turned out to be true. So I will not go into how we store data and so on and so forth, because it's I'm not the right person to answer that question in detail. If you are in this space, you cannot survive without investing a lot in the right software, the right storage, so on and so forth.
And also speaking about the personal data, how can we ensure that the client's personal data is safe? Can you tell us a little bit more about the data security?
So we're a European company, so we also have GDPR to take into consideration. We have invested massively, again, from day one, into data security issues, and we have like a number of systems to ensure that we handle data properly. And again, sometimes you feel that this is, of course, that this is a hassle, basically, but you have to do it no matter you like it or not, because we have these regulations. But again, if you do that in a clever way, you can turn it into a competitive advantage, because our customers, which are very often healthcare providers, if we show them that we understand how to handle data in a secure way, that gives us an advantage compared to competition. So for us, it has been sort of part of our success story that we actually prioritized these issues.
I didn't know it exactly, but it's interesting to understand that you have the norms and terms and you need to follow them. It's obvious, of course. Right now, I want to ask you like few quick questions and you need to choose only one option. These questions are related to your previous career, your preference and interests. So, doctor suit or business suit?
I have used a doctor's suit, but I'm not a doctor, so I have to choose business suit then, even though I very rarely wear a business suit anymore, but it happens still.
Okay, investing or founding?
Both. I was not allowed to answer. I really want to answer both, but let's say investments then.
Okay, going solo or working with a coach?
Working with a coach, for sure.
Risky innovations or proven methods?
Risky innovations.
Interesting. Skiing or winter swimming?
Both, but winter swimming.
Yeah, I saw that you like it. I think that it's all for today. Thank you, Maria, for joining us on this interview, Building Digital Products by LinkUp Studio. It was interesting to speak with you and get to know more about your business and your life experience. So thank you very much for this.
Thank you.